Is there such thing as a secure attached person?
Yes.
There is?
Yes.
Really?
So
What?
I guess the disclaimer that I skipped is that you can have a secure attachment and still get anxious or still get annoyed or still get upset. It's not like you're immune to those experiences. It's just about how you respond and move through that. Sometimes I get excited and I ramble, so that's why I'll stop and I was saying, like, does that make sense? Or sometimes I'll be like explain things and I'm having the best time, and then I look at my client and they're just like,
I'm having the best. This is Liv B
with Liv B.
We are joined by the lovely Sam today. We are very excited to have her on as she is a clinical psychologist. So I'm sure along with B and I, you guys will love all the questions and the topics that we have planned for today. So welcome, Sam.
hi.
Welcome.
Thank you.
She's a listener as well.
Yes. An OG listener.
An OG.
We just went through the episode she hasn't listened to though. So she's got something to do when she leaves.
Yeah. We'll be emailing her about that later. No, but we're so excited to have you on today.
Thank you for having me.
You're welcome. We'll be focusing on attachment styles, which we've mentioned on a few episodes before now. So that'll be super interesting, and just go through your, I guess, background and then get into those attachment and what exactly they are, because a lot of people don't really know what attachment styles there are. But first, let's start with what is the difference between a psychologist and a clinical psychologist?
Yeah. Basically, the difference is not that significant. So that's the first thing to be aware of. A clinical psychologist is someone who, after they've graduated and been given a title of a general psychologist, then does an extra amount of kind of like work and criteria that they check and the style of supervision that they receive over a certain period that endorses them as being a clinical psychologist. And what it just means is your endorsement is like the area that you specialize in or mainly work across. For clinical, it's mental health. So there's all different endorsements. You could be an educational psychologist, so within schools, organizational, within businesses. There's all different ones. So clinical is more about focusing on mental health.
Yeah.
That makes sense.
Yeah. And does that mean you can give like medication and stuff as well? Is that what that means?
No. So psychologists can't prescribe medications at all.
Okay.
That's psychiatrists.
Gotcha.
Which is often also confused.
Yeah.
So psychiatrists do a medical degree, which allows them to prescribe medications. Okay. But psychologists, we focus on thoughts, behavior, and emotions. So while we might work with people who do take medications and receive medications from GP psychiatrists, we don't prescribe them.
Gotcha. Yeah. I was wondering that.
Yeah. It's a common question.
Okay.
Yeah.
Perfect.
So how long have you been in this industry?
So I've been working for the last 4 years.
Yep.
I recently went into private practice in the last year as well. So that's been really fun and interesting. But yeah, and it's been really cool. Like I've had a lot of different experiences, a lot of learning, a lot of training. So it's been really nice. Yeah.
Did you always know you wanted to do that?
No.
Growing up? No?
No. I had no idea what I wanted to do. And actually my sister's a psychologist as well. So there was a big period where I was like, I'm not doing that. I can't just be her shadow. So I actually avoided it for a long time. And I didn't go to uni straight out of school. I then, when I did decide to go to uni, went into a teaching degree and then kind of didn't really feel right. But there were some aspects of it that were sitting like nicely, but then I was like, this isn't it. I don't know what it is, but it's not it. And then just kind of talked with my sister a little bit, and we decided that actually the part I did like about it was psychology. So transferred across, and once you start a psychology degree, you pretty much can't stop if you want to be one. So it's a long haul. You just get really committed and do it. And,
that must mean you're very passionate.
Yes.
Yeah, and the studying would be so intense as well.
The first 4 years, you essentially have to be the best in your cohort or one of the best in your cohort. It's all grades based.
Wow.
You do a lot of learning, but you also do research. So you do a thesis, and so you have to get a certain level of or a certain score on your thesis in order to be considered for masters. And so, yeah, it's all very competitive for the first 4 years. And then once you're in master's, it more focuses on your therapy and your intervention and your clinical work. So, yeah, it's pretty tough. And the places are very limited. So, you know, I've had a few students in their 4th year of uni who are wanting to apply for masters and just knowing that they may have to take a year or 2 off because the people applying versus the number of places that are available is very disproportionate. So it's really hard.
That would be scary to feel like your momentum could be hindered. But I guess like you're not going to do it just because there's a fear that you might have to have that little break. But it's like such peace of mind for anyone that wants to go see a psychologist that it is filtered like that in the first 4 years and then the spots are limited. Like it gives you just that extra trust in who you're opening up and being vulnerable with.
Yeah. And, you know, I guess that's probably the hope with the structure that they've got.
Yeah.
They do hold us to a very high standard. We're also ARPA registered, which means we're held to ethical guidelines. We can be reported if we're acting in ways that are not ethical or considered a breach of our conduct. So, yeah, we're held to a very high standard. It is very hard, but it's very fulfilling. And, yeah, like you said, it's kind of weeding out to make sure that this is the role that people want and that they have the skills to be able to deliver it.
Yeah. If you think about the actual environment of like your experience with a clinical psychologist, you are in a room with the door closed.
Yes.
So
now the door's wide open. Everyone
you're on stage.
Everyone come join.
Yeah, but I was just thinking, what if you're like not mentally, like you don't trust yourself, so then you're trusting someone, and then what if they're doing something wrong and you're in this closed room, like.
Exactly.
Yeah. Well, that's why it takes time, I guess, to find someone you're going to gel with.
Yep.
Like when I went to therapy for a little bit, but it would have just been, I guess, when I say normal psychologist, like I don't know how to word it or what the difference is, to be honest.
If they don't have a clinical title, you mean, they are called psychologists. So you just don't say clinical in front of it. But we as clinicals wouldn't be offended if you said psychologist and didn't include the clinical. That's okay.
And therapist, same thing.
Yep.
Yeah. Yeah. So I had to see a couple before I found someone that I obviously gelled with, because it's hard. Like you've got your personality traits, which is just in life in general. Then obviously what you were saying, if they're not like confident in that space, you can feel that. So it would take some time to gel.
And it does. And I always say to my clients or people who are looking for psychologists, it's kind of sucks, but it's trial and error. And we are just people at the end of the day, and you don't gel with everybody in life. So your psychologist is no different. You know, and you need to be able to feel like you can at least have a minimum level of getting along with them if you're going to have the comfortability of hearing and putting in practice what it is you guys are working on.
So true.
And so it's okay to not have a right fit. I would just say don't let that be the reason that you don't continue.
Stop.
Was there a pivotal point? I guess there would be a lot of things in your study, but that feeling of reminding yourself that nothing's personal. Like if someone was to come see you and then you hear that, oh, they're not going to rebook, or they had a thing booked, appointment booked, and then they cancelled it, or they've gone to someone else in that practice. Like
my feelings hurt. No, so yeah, I guess that's something you work on. You always have a supervisor, so you always have a supervisor for life as a psychologist, which means it's someone you engage with kind of on a monthly basis if you've been working for a long time, or more frequently if you're newer to the field. And these are some of the things that you might work on with them, because exactly that, like you can't be taking things personally every time, particularly if it's not personal, because that might get in the way of how you show up for that client if they do decide to come back, or another client if you're worried about personal things coming into practice. So it's something you work on. We call it transference or countertransference, where the relationship between you and the client might be getting in the way of the therapeutic relationship. And so there's certain skills and practices to safeguard that, I guess, to try and ensure that that's not affecting people's outcomes.
Yeah, wow. There would be so much that goes into, like, for example, a patient will just think, I book an appointment, I go sit in a room, and then they can just leave after. But then there's so much that they wouldn't know about that you have to do. And it's just, I've never actually thought about it in this depth.
Yeah. And you know what? That's probably a good thing because that shouldn't be sitting with you to think
So
about as the
true.
client anyway.
Yeah.
There are times when I would bring this up in a session, like if it needed to be addressed, if there was something uncomfortable or a client's reacting to me in a certain way, or, you know, that's something that a psychologist should kind of talk about and move through because, again, that could be the barrier to them kind of progressing and moving forward.
Yeah.
And it could be impacting their willingness to actually engage. So we actually call these things out in a skilled way. We don't just like, you did this or you're saying this.
Hey, am I sensing attitude?
Yeah. But in order to kind of address those kind of things, there's, again, skills and structures in place to try and support it.
Yeah.
That itself that you see in session could be the difficulty that people are actually having with other people. So they could be behaving in a certain way that they're not actually recognizing or aware of that's affecting how other people are interacting with them. So that itself could actually be addressing the problem.
Holy moly.
That's why you couldn't even be, it's like anything. You can't like be thinking it's me. You have to be taking in what they're actually, their body language, everything, but it has nothing to do with you. It's about them. Same as in life.
Yes.
Dating.
Yep.
If we can't be sitting there going, oh my God, he did this, or that means he's not vibing with me. You know, it could be the complete opposite thing.
Yes. Wow.
Yeah.
Your brain would be like going in so many different ways in one setting. I'm like, are you analyzing us?
And to be fair, sometimes it can be me. Like, I'm not going to sit here and say like it's never me. It's always their problem.
Yeah.
No.
We each have different styles, personalities as well, which comes into your therapy room. And for me, I'm someone who's quite direct and upfront. And that's not typically how you think of a psychologist. I think stereotypically how people think of psychologists is that they're quite soft and gentle and quiet, and there's like the therapist voice, and I've never gelled with that, and that's just my personality. And there's people who really, really respond to that, and there's people who don't, and that's okay.
Yeah.
People, and that's not to say I can't adjust. I will adjust when needed, but as I was saying, their style has to suit you, and sometimes it's just about the style, and that can be something that is the therapist's problem, I guess.
Yes. When you go back and go, what was the thing that I was really interested in? It makes sense because teaching is getting to know how every child learns, and everyone is so different. Yeah. So, was that the thing that you were super drawn to of what makes people tick, and then that carried you into psychology?
When I actually noticed, I was like, I don't know why I'm in this course, was when we had to learn all the different maths. Like the amount of ways that people learn maths is outrageous.
Wow.
And I was like overwhelmed. But then I was also like, I'm learning this because I'm being told to learn this, and I don't actually feel the drive or the motivation to see the long term of like, oh, I'm learning it because I'm going to make a difference. It was hard for me to connect that specifically from a teaching perspective. There's so much psychology that comes into teaching. But there was actually a thing that happened with one of the children on one of the placements I was on, where she got really visibly upset when she needed to hand in some homework. And this was like, I think they were grade preps from memory at the time. So very, very young. And so this really significant reaction she was having, I was just so curious about it. And then I kind of went and regulated, which is kind of like calming her nervous system with her. And then that's the event I spoke to my sister about afterwards. And I was trying to unpack it, and I was trying to like make sense of all the parts that maybe were contributing. And that's when my sister was kind of like, Sam, you're doing what we would do to like formulate what someone is struggling with and kind of why they present the way that they do. Like that's the crux of psychology.
Yeah.
Oh, okay, that's what it is.
Oh, maybe I do need to do it.
Having a sister and being in the same industry, it definitely makes you want to consider all options just in case you can kind of do something similar but not quite. But then when you grow up and you're doing the things that you're passionate about, all you do is support your sister, and you're like, who cares if we're in the same industry, because you're both completely different. You're both going to offer a completely different experience, you know, so.
And we love it now. We laugh about it.
Yeah.
When you kind of like tell new friends or other family members and whatever, like, we're both psychologists.
Yeah.
We just like think it's so cool and funny. And they're like, oh, okay.
But it's nice
something about your family or
It's nice that you can just understand each other too and relate and go, oh,
definitely.
Have you ever experienced this? Or obviously client confidentiality, but, you know, between sisters, you can, if you don't tell.
What are the things, like if someone was, you know, you were needing to calm their nervous system, what are your core focus? Because I feel like a lot of people would be able to relate so much to that.
Yeah.
Especially when, you know, if you see a friend or a family member or something, they're having a reaction, what would you suggest to do?
Yeah, so I work very heavily around kind of body reactions and sensations throughout the body. I'm doing more training on something called somatic therapy, which really focuses down that pathway. But what I do, particularly with people in session, is kind of like you might start with something like a body scan, or if I can see that someone's kind of had a shift in their what I would perceive to be their emotional state, which is just me observing their body language or shifts in their tone or something like that. I might just kind of pause and be like, what's just come up for you? Like, what's happening there? And then they might, you know, be able to connect to the thought, or they might be really lost and confused, or they might say, like, I'm noticing like a feeling here. And then we would kind of just really hone in on that feeling. And so it's like, okay, there's something in your chest. Like you kind of pointed here. Often they'll be like, oh, I'm just feeling something. I'm like, okay, you're pointing here. Like there's something happening in your chest. What's happening? Would you describe it? Or, you know, what is it feeling like? Or have you had this feeling before? And just kind of walking through like what's happening in their body. A lot of the time just doing that is enough to actually relax that response and bring that response down, because it's like acceptance and acknowledgement that your nervous system is doing something. And it's serving some kind of function in that moment. So there's no use, essentially, this is like the principle, there's no use in ignoring that, because it is trying to signal something to you. And I think a lot of people's default that I have spoken to anyway is to kind of want to push down the uncomfortable feeling or push down the uncomfortable sensation, which then makes it really hard to move through. If you're disconnected from that, how can you kind of comfortably resolve that when you've kind of put it over there, and then you're wondering, like, how do I move through this? Like connecting to it is going to be that first part.
It is interesting to think that without this knowledge, you disconnect your mind from your body when, like you just said, like you need to sort of merge them to feel like you're acknowledging, to then move forward. And having that mind-body connection, from my personal experience, is like the easiest way to bring you back to the present moment. So, and in your line of work, a lot of people wouldn't know how to communicate how they're feeling. So that's why, you know, assuming that you watch their body language and the reactions that they're having to help them then identify what's happening potentially in their brain.
Exactly. And, you know, labeling can be really hard when it comes to emotions. Like not everybody's taught about emotions or what they look like, what they feel like, how to move through them. So having someone sit across from you and saying, what are you feeling? And they might say, I don't know. It's then helpful to be able to move into a place where you're just describing what's happening rather than needing to have the answer.
So it goes back to, you know, when you feel a gut feeling, that's for a reason. It's the same sort of thing. Mostly when you do feel the tightness in your chest. And then if you're thinking about that, it does take away from your anxiety up here. It's more, let's just breathe through that. And it's like anything, like you get taught this in so many forms. Like I'm just realizing even in acting, and, you know, you get up to do a presentation and all the courses that you've done, it all relates back to what you've just said. Is standing in your body. You feel that anxiousness, you feel that tightness. Where is it? Okay, it's in my chest. Why are you feeling that? Breathe through it. And it always brings you back down to earth.
So you're naturally kind of doing a lot of self-regulation, it sounds like.
Just in any, you know, presenting course that I've done or acting course, it's always about that, because you're standing in front of loads of people. Doesn't matter how confident you are, you're still going to get that tightness. And mine was always in my chest. And then I would be shallow breathing. And I'm like, why aren't I breathing all the way down into my belly? And I remember I would just get really frustrated, and she would say, just put your hand on your belly, hand on your chest, breathe into your belly, take like 3 deep breaths, and it would always just calm me.
It's really cool. It's really cool that you we're taught that through acting. Because like you said, there's little pieces of this kind of like everywhere that you might pick up along the way. But even doing breathing like that, like that's a skill. Learning how to breathe from your diaphragm versus like when you're potentially anxious and shallow chest breathing, that's a really hard skill to learn. The first time I do that with people, and you kind of breathe in and then see which hand is moving, and that will tell you if you're breathing the lower breath or the shallow breath. Like that's a really hard skill to learn, and that's all therapy is learning skills to be able to self-manage. My goal is to have people not need me. My goal isn't to have people stay with me forever. It's to give them their skills to be their own therapist.
Yeah. I love that.
Yeah, that's awesome.
Well, on the topic of anxiety, shall we categorize the next however long we're going to talk about it and talk about anxiety and how does anxiety show up and what are some symptoms and signs that people could probably push away that are maybe the first signs or small signs of anxiety. And let's just start with that. And I'm like, I got nothing else. Let's start with that.
That's perfect.
So there are some really common symptoms, we'll call them, that people would experience of anxiety, and everybody's different. So the way that people might experience anxiety may not fit this exact mold. But generally there's pretty common themes we would see across different people. And so everybody's different what they tap into first. So some people are very body focused, so they might notice their physical reactions first, whereas some people might be very mind focused, so they might notice their thoughts first. And so anxiety showing up in the body might look like racing heart, tight chest, tightness in the throat, nauseous stomach or butterflies in the stomach, pins and needles in the hands, tension in your muscles, headache. These are pretty common things that we would find talking to people when they're describing anxiety in their body. So that's one way. And then with your mind, it might be noticing more rumination or particular style of thoughts about worry or racing thoughts or hard to catch your thoughts or flooding of thoughts. So many thoughts coming in one after the other where you can't really make sense of kind of what's happening in your mind. So there's some common ways that anxiety might show up in your body versus your mind. Did that kind of answer the
that
question?
was really good elaboration or summary, because I feel like it's really hard to sort of pinpoint what it is. And if you're looking at the side of anxiety that is in your mind and your brain, it does generally feel so scattered in itself. So how are you meant to identify certain things? Like, for example, if you have a headache, how are you meant to identify that as part of maybe an anxious day for you or something rather than dehydration? So do you know what I mean? Like,
exactly.
And it's only come to my attention maybe the last year that anxiety does show up physically. So it's baffling to me how it just is different for everyone. And I actually remember being a teenager and thinking that stress was a myth. Like, I would hear adults around me talk about it all the time. And I just thought, it's not real. Like, it's just a word that you're saying because you don't know how else to categorize, I don't know, your day that's been a bit busy. And then you realize that stress has a physical impact and it's such a real thing. So obviously, like anxiety, it's such a real thing in so many different ways that I think a lot of people don't take the time to identify.
Or just may not have the awareness of or the resources to kind of connect with, like you were saying. And that's why I really like working with like the physical sensations, because like you said, sometimes your mind is racing, but you're like, what the heck's going on in there? And then if someone was to be like, what are you worried about or what's happening, you may not be able to verbalize that. So the physical side of things that I like to focus on targets the nervous system. So anxiety, basically what it does is activates your nervous system that there's some kind of threat. And, evolution-wise, this came from when we need to keep ourselves safe from the lions, or there was a predator we would need to run away, or there was a different, there was a threat to your, like where you lived or whatever, you would need to fight. We've evolved so much over time and we have all these complex emotions that we're really aware of now, but that system's still really primal. So the threat might be somebody upset me, or somebody called me something I didn't like, or I forgot about the appointment that I had, might be the threat. But your nervous system is still reacting as though you're essentially about to die.
Yeah, do you see all those trends on TikTok? How it's like, unfortunately, my body doesn't know the difference between getting attacked by a bear or having to call the dentist.
Exactly.
Like that trend, like just is like obviously a funny way to add to what you just said.
Yeah. And so it has a really specific function, and your body thinks it's protecting you and it's doing a good job of doing that.
Chill out, babes.
Yeah.
We good.
Yes. Then it becomes our job to try and help it recondition and learn that, okay, I'm a bit uncomfortable, or I need to call the dentist or whatever it is, but actually physically I'm safe. And this only applies to if you are physically safe. Obviously don't apply that principle if you are actually unsafe.
If you're getting attacked by a bear.
But that's what the work becomes. The work becomes reconditioning your nervous system to understand that that's uncomfortable. I don't like that. At the same time, like, I'm safe and I can regulate that response to be able to then make an appropriate decision. So when you're in that state, you're not making your best decisions. It's not possible.
Do you think that anxiety has been like mislabeled in today's society? Like, I feel like it does get thrown around a lot. What are your thoughts on that?
I would be curious to know a bit more about it, I think. I think maybe I haven't been exposed to people saying they're anxious who aren't actually anxious. So what do you have like?
I feel like it's just, whether they're joking or not, it's just been such a common thing you hear, like, oh my God, I have anxiety, or you're out doing something and it's clear, you can tell the difference between someone who actually has anxiety and then people that just throw around anxiety.
Okay.
And I was wondering if that's something you've noticed, or if that's something that's discussed in your line of work, or...
Yeah. And I suppose like maybe what you're speaking to there is having a diagnosis of generalized anxiety or some form of anxiety disorder versus experiencing symptoms of anxiety. Like, those two are two different things. You can be someone who experiences anxiety or has symptoms of anxiety, or but doesn't actually meet the criteria for an anxiety disorder. So maybe there's that side of things that you might be thinking of. In terms of like that being thrown out, I would only make an assumption, but I'd be curious. Sometimes people just kind of learn the word or learn the phrase, and then that becomes generalized of like, I'm feeling something, and anxiety is a word that's comfortable or accepted or acknowledged, so I can just use that, but not actually being aware of maybe what their true reaction might be. I do think anxiety is quite widespread. I think there's probably a lot of contributing factors to that generationally.
I was going to ask, have you noticed it being a lot more younger people that come to see you, or, older, or if that's something you've noticed lately?
I have quite a mix of age groups. So I see 16 and above. I've seen people in their 70s. I've seen middle-aged people. I've seen young people. But interestingly, and I know we're kind of moving into attachment at one point, but interestingly, I've been noticing a lot more young females being a little bit more avoidant rather than anxious, which is some of the attachment styles we'll kind of talk about, like
That's
we said.
interesting.
Yeah, and it has been something I've been really interested thinking about in the last few weeks in particular.
I wonder if do you see that as a good thing, that people are going more avoidant than anxious, or is it there's still pros and cons to both, obviously? But I would think, if I was to assume before you saying that, I would think it'd be the opposite, that people are more anxious attachment than avoidant. So that's interesting.
And to be fair, I don't know the stats. This has just been anecdotally of who I've been seeing. Who's been coming into my rooms, or the presentations that have been coming into my rooms. But in terms of one being kind of like better than the other, no.
That's what she's getting at. I feel like it's better to be avoidant.
Is there one that you identify more with? Is that?
No, we did like a question box the other day, and they only gave us those two options. Okay. So I know there's a few, well, I'll let you explain what other styles there are, but in this particular scenario, it was, are you more anxious or more avoidant? And if I was speaking personally, I'm more avoidant. But that was just because we just had those two to choose from. So,
Wait, I don't want to jump to that yet.
I know, okay.
I'm like, stick with the anxiety. I'm getting anxious. No, I'm kidding. I'll probably cut that out. It's insensitive.
No. Exactly what I was talking about before.
Yeah, you're like, it's getting thrown around. You're like, you lying.
Yeah, it's hard. I don't know. I've got my own thoughts on that because it is such a thing that people who really struggle with anxiety, it's something that I don't agree with throwing it around, and I can't relate to that because for me, I am a bit more blunt in that way of if you're feeling something, change it. Like with people who suffer with deep anxiety, it's a deep-seated thing that you don't want to take away from that.
It does kind of come back to the conversation around stigma and mental health. It's not something you can always see.
Yeah.
And so that's really hard to try and qualify with really tangible things. So if we're trying to measure things to see whether that's the case or that's not the case, mental health is really hard to do that.
Yeah.
And sometimes this is where stigma can come out of, I can't see that, or, that doesn't make sense, or, you don't really feel, you mustn't feel that bad because, or you mustn't be depressed because, things that kind of conflict with that.
Yeah. So I guess back to what B was saying, do we think that it's getting thrown around a bit too casually these days? To finish that statement is there's a different scale for everyone. Yeah.
And I guess something I talk to my clients a lot about is things don't have to be extreme for them to be important.
Yeah.
And so, when people ask a lot about, what is trauma and what qualifies as trauma, and we always talk about, that's personal to the individual. So what you might experience as trauma, the next person might experience as their Sunday,
Yeah.
So it's really hard to kind of generalize it across everybody when, the scale's, I guess, individual.
I like that sentence. Doesn't have to be extreme to be important. That's like you see in gyms how it's like, you don't have to be extreme, just be consistent. There's one-liners that you're like,
I haven't seen those at the gym personally, but that could be motivating.
Yeah, could be. But just those one-liners that stick with you.
Yeah.
I think that's a nice one to have in your back pocket, ladies, whoever's listening. It doesn't have to be extreme to be important or to talk about it.
What does, I guess, for you, or what would be your advice to someone who's wanting to, on a day-to-day, figure out little skills to calm their nervous system or to, I guess, just be more in touch with how they're feeling? What would be your core little advice?
The first step I always give to clients who struggle with that is just taking even a minute per day, 1 minute, to check in and just from head to toe describe and notice what's happening in kind of each area of your body. And if you notice something signaling, you don't have to do anything with it yet. This is just the first step, but just notice it and describe it. So if you kind of are just running around all day, doing a lot of things, and you're kind of not really present or not really being aware of what might be going on internally for you, if you just took a minute in the middle of that, and then you might notice, oh, actually my hands are really clammy and sweaty and I didn't notice that before, and you just describe and look and notice, like that's enough to start that process. So it doesn't have to be big steps. Something as small as 1 minute per day of essentially being mindful can be really helpful. And 1 minute over 1 day over a long period of time becomes many, many minutes.
Yes.
And I love that. I love that it doesn't have to be a huge thing, something simple, easy.
Yeah.
And it can help in the long run for sure. Another question I was thinking about was, self-sabotaging. Why do you think we do that when things are going really, really well?
It can be a few different reasons. Again, for me, this would depend on your attachment style and the function of what that's doing. I'm mindful that you guys didn't want to go to attachment style.
Let's do it. Let's do it.
Yeah.
Well, because I feel like there's so many. I feel like anxiety.
I feel like we're gonna. I feel like we're gonna maybe jump to and from. But I think the reason I don't want to jump straight away is because I have a few friends that I really want to advocate for that are struggling a lot at the moment, and just that tip of that 1 minute, sorry B, to just completely just like take it back. But this is why I don't want to jump straight there, because we're going to get into the attachments and talk so much about it. But that 1 minute for people who I know are struggling seems impossible.
Yeah.
So can they start with their feet?
Yeah. There's no rules around it.
Yeah. Because I feel like for me, if I was feeling all over the place and I started with my head, immediately I'm going, well, my brain's in there and it's going everywhere. And then I would get overwhelmed and then I would just cancel the whole thing and then I'd probably be stuck again.
Yeah.
So, you know, if they do successfully go from their feet to, you know, their calves, their knees, what can they do if they, you know, feel like, okay, this is feeling all right? What's something else that could be helpful, or what is another way, another first step if they don't want to actually think about their physical self?
And thank you for bringing that up, because it is something I skipped over, but it is something I do talk to my clients about. If you're someone who's not used to giving yourself that time or being allowed to have that, even just that minute of going through that, it's going to be so uncomfortable. You're going to hear like that critic come up and say, don't worry about it, don't bother. It's not going to feel nice because it's a different state. If your body's always in a physical arousal state of anxiety, slowing down and bringing calmness, that's going to feel uncomfortable. Your automatic reaction is, I want what's comfortable. So you're going to want to go back to it.
Yeah.
And so just validating that, I guess, is that it's okay that it's going to feel uncomfortable. It's okay that you're going to notice resistance.
Yeah.
And it's probably likely that that's going to happen.
Yeah.
Again, it's not a reason to stop.
Yes. Okay, I like that. So success with this tactic doesn't look like it being smooth or easy. Okay, yeah.
And
so
it may not solve all the problems, right? I don't think if you're really struggling with chronic or really intense anxiety, I don't think a minute of mindfulness per day is going to solve all your problems. Yeah. And being realistic about that too. What it might do is start the process to be able to get you to a place where you can actually address and target the actual problem or the driver or the core underneath that of what's keeping you anxious.
Yeah.
Anything physical, I would say, is the other first thing. So if you're not, you know, making too much progress with the 1 minute of mindful like check-ins of your physical sensations, doing something physical, like whether that be stretching or taking a walk in the sun or anything else physical that you might like to do. You don't have to be creative about it. You could just jump up and down on the spot. Just something physical that will get your body moving is also a really good place to start.
Yeah. Okay.
Because your anxiety is living physically. So doing something physical is naturally going to regulate your nervous system without you kind of having to think too much about it.
Yeah.
Overthinking, do you see that as a sense of control? Like would you see that as us trying to be in control of all this stuff and that's why we overthink all these things? You know, some people who do overthink a lot, is it because they're trying to control every situation? Or
why do we overthink? Yeah, that's a good question.
9 times out of 10, any unhelpful behavior we're doing has started from a helpful place. So it hasn't just cropped up out of nowhere with no reason. All behavior has function. It's just about what that function is doing. And so when it comes to overthinking, and without like having someone in front of me who's kind of going through their story, my first assumption is there's some level of protection this person needs against unpredictability. Unpredictability is a threat to our nervous system. So we like to pretend that we're like random and quirky and we love spontaneity and, you know, we like to say that as humans, but we actually love predictability and our bodies need predictability. So overthinking and pre-planning things or preparing for the worst is an attempt usually to eliminate something being unpredictable, because if it's unpredictable, then it's threatening.
Yeah.
Does that make sense?
Like almost like fear as well.
Yeah.
Yeah. So it kind of is
control.
You trying to, find control.
Control the outcome that you can't because you don't know the outcome.
Yeah.
Like we don't know what's going to happen.
Yeah, find comfort in environment that you might set up to have all these things that you don't want to face in, even though How are you meant to know?
Yeah. And for some people, there might be lots and lots of aspects of their life that is already unpredictable. So when they're controlling like a certain aspect, it may actually be the only predictability they have.
Yeah.
So you think about someone who's in a really unpredictable environment or household where they don't have a lot of safety or protection or something like that. They may control in other areas because that may be the only way that they can do it.
Yeah. See, every case is different. Eh?
Yeah.
What are you going to say?
Because everyone's upbringing is different. I was just thinking when you brought up, I just thought back to, young, I hear a lot of in therapy, they always say, think of obviously your younger self and relate back to little version of you. And I mean, I can think why that is so important and why that gets through to people. But why is that a tool you would use, and why do you think it's so important to people to really take themselves back to when they were younger?
So the basis of doing that for me is about understanding the development of your attachment style.
Okay.
And I know I've done it again.
No,
but
I think we're on track.
I work so heavily in that space.
Because it all goes back to attachment and to why,
And for me,
Makes
as someone
sense.
who practices very heavily from that space, it's always going to be where I end up, or at least something I'm drawing on. That not everybody works from that space or that theory, and that's okay. Therapy has all different styles and all different approaches. But for me, attachment is a really huge part of what I work through with people. And where your attachment develops from is your childhood. Right from birth, even pre-birth. And so it's a long-standing thing that's developed over time. You generally have one particular attachment style that you form based on your experiences growing up in your environment. That usually follows you throughout your life, but it's not necessarily fixed. You can change it and you can work on it with awareness and support. So if you were someone who had a insecure type of attachment and you wanted to shift that over time, that's possible. But generally we see it as pretty consistent throughout your life.
I was just going to ask what the attachment styles are.
So there's all different ones, but for the purpose of kind of summarizing it, we basically look at secure and insecure attachment. So secure being confident in kind of yourself, who you are, your ability to be flexible and approach things and adapt to different things, to have difficult conversations, to be emotionally regulated, and be able to connect to emotions, kind of not scared of emotions. Assertive communication is usually part of it, and knowing that there's a secure base that you kind of go to and from, and somebody's reaction kind of doesn't tip that for you, if that makes sense. So that's kind of a very rough summary of secure. For the purpose of insecure attachments, there's two that I normally mainly focus on, and I refer to them as avoidant and anxious attachment. For anxiously attached people, usually there's some fear around abandonment or being left alone, insecurity in the sense of not feeling important or feeling like their needs are not met or worthy. And a lot of the behaviors that come out, which I'll talk a little bit about, are attempts to try and gain a sense of worthiness and importance, usually externally. You're trying to get those needs met externally because they're not there internally. And so this could look like clinginess, seeking excessive reassurance. It could look like being really critical and demanding. It could look like outbursts or kind of big emotional reactions. And as I say, these are kind of attempts to try and get that need met of feeling like you're important or you're worthy or that people aren't going to leave you. So that's kind of a summary of anxious attachment. And then we've got avoidant. Avoidant attachment normally stems from a place of feeling like emotions are not safe or not trustworthy, or closeness and connection is threatening in some way. It also really focuses on this sense of like hyper independence. And so, yeah, it can look like emotional distance, minimizing, deflecting. It can look like people pleasing sometimes. And all of that behavior is coming out of a fear of not wanting to fail. So not wanting to let people down or fail, or being worried that they're going to lose their sense of independence. So that's kind of like the summary of avoidant attachment. Did those make sense?
Yeah, that was perfect. Did it make sense for you?
Yeah.
Yeah. I mean, so secure attachment is literally like sitting on its own, as it's just like, that's like goals. Like you're good. And then under the insecure attachment comes the anxious and the avoidant.
Yeah.
Do you think that people can have traits of either without any childhood trauma, if that's the right way to say it?
They probably won't switch, so it won't be a sudden thing. But what I talk to my clients about, because a lot of them might say, you know, I always thought I was secure, and then they might give examples of why they thought that, and then when we actually look at that, it's actually not security. It's just what they know.
Yeah.
And now I've lost my train of thought. What was the question?
I said, can you, if you had a great upbringing childhood, like no trauma, can you still present as anxious or
yes, that's right. And so the other thing I tell them is, it's kind of like what I was saying before. It doesn't have to be a significant or extreme traumatic event in order to develop an insecure attachment style. It can be something small that was repeated over time. It can be, you know, only a few instances. It can be, you know, from things at school versus just with your parents. 9 times out of 10, we do really focus on the caregiver relationship. So if it's your parents or whoever kind of like raised you. But yeah, so there doesn't need to be a big significant event, which means that, you know, your trajectory changed from there on. It can just be little things that seemingly you wouldn't assume would have any impact, but they do.
But there's always, I guess, something to unpack when someone presents as an insecure attachment.
So much
is what you're saying.
But what you'll see is the patterns in adulthood are repeating the patterns of childhood.
Yeah.
Which I think comes back to your question of why that's important.
Yeah, and why seeing yourself. I think it's just the imagery as well. It's the easiest thing to take yourself back and picturing you at that age. I know for me, I always see myself whenever I think of me younger, it's always me at 4 years old. And I'm like, why do I go back to 4? Yeah. You know?
What do you remember?
I think it's just me at 4 was always like, I was so, my imagination was wild. All the stories was from when I was 4, and I was this huge personality, and I would just go back to her because I'm like, she had no fear. Yeah. She was so funny and like did all these funny things, and her imagination was wild. And that's always what I think of. Yeah. But yeah, I think that's what would get people in that really vulnerable state, is to be like, okay, think of you as little. And it would get people choked up because you're like, shit, she was so innocent and she was so all these things that you want to be now, and everything shapes you as to why you can't be like that. And again, going back to acting, the best actors are child actors because they don't have any of those thoughts. Yeah. You know, so it makes sense. And that, goes back to, which I'm interested in, why or what you see in people when you bring up, think of you as a child, and why you think that is such a pivotal thing to do.
So I think the way that I might ask them might be slightly different, because I think, you know, it's great that you can connect to that so quickly. For a lot of people, it's not that accessible, particularly people with insecure attachment. Yeah. Their first response is usually, I can't remember much of my childhood, or there's big patchy bits. So what we would usually start with is kind of like an example or an experience, or the way that they kind of see themselves. So I see myself as stupid, for example, might be one that I hear. And then the way that I would ask would be, have you always felt like that? And they're like, yep. Okay. If you think back to like primary school, do you remember like having thoughts of that in primary school? And then they would kind of like sit with that. Oh, yeah, actually I do remember that. Okay, what about like kindergarten? Do you remember kind of having thoughts that you were stupid there? Oh, no, not there. Or yes, there. So like just kind of walking them back a little bit, I guess, slower. I think,
Not as
sometimes if you can
directly.
say, think about yourself as a child, it might be too much too quickly for some people, or it might not be accessible. Does that make sense?
Yeah. Yeah, and it'd be hard because people would block out so much. So it would take those questions to really be like, oh, actually, yeah, that did happen. Wait, no, that didn't happen, because you just make up things or block out things that were, wow.
Yeah.
It's so interesting.
I think
it's very interesting.
Yeah, it's crazy.
Yeah, because it goes to everything in your life, you know, and what people are always trying to figure out, or what we find is just they're trying to find meaning or understanding or connection in other people. And then it goes to the different thing of you meet someone and their attachment style is different to yours and how you can deal with that. Which is, stuff we're always going to have to be dealing with.
Is there such thing as a legit, secure, attached person?
Yes.
There is?
Yes.
Really?
So I guess the disclaimer that I
It's a myth.
probably skipped is that you can have a secure attachment and still get anxious or still get annoyed or still get upset. It's not like you're immune to those experiences. It's just about how you respond and move through that.
Okay.
So someone who's insecurely attached might get really stuck there, whereas someone who's securely attached, if something, you know, upsetting or negative happened, they would move through that in a different way.
Yeah, so they can go
self-regulate.
Yeah, they do that whole like, all right, that I'm feeling something, I'm thinking something, but it's just feedback, and I'm still in control of how I deal with that.
Yes.
That's
and
I've done that.
addressing
Maybe
that
I'm secure. I've done that before after therapy. Okay, yeah, you're really like answering the questions like really well.
Oh, good.
Oh, yeah, I know. I didn't expect anything less.
Yeah.
But
Sometimes I get excited and I ramble, so that's why I'll stop and I was saying like, does that make sense? Or sometimes I'll be like explaining things and I'm having the best time, and then I look at my client and they're just like,
I'm having the best. Because it would be so mentally stimulating for you as well to share these things that you've learned. And do you find that when you're explaining things, you're visualizing a lot as well? Like even when we're talking in the pod right now, I feel like I'm visualizing the categories in like a, you know, and so when you're explaining things, I'm actually creating some sort of visual. Do you get that?
Are you a visual learner? Do you know?
I'm not sure.
Yeah. That's okay.
But I don't know if this even goes hand in hand. I'm very photographic memory. What's it called? Is that visual learning kind of? Like if I see something, even if I'm not actively taking it in and someone asks me about it, I'll remember what I saw.
And when you remember it, do you see the picture?
Yes.
Yeah. So probably, and like when you were learning in school, like did you like graphs and colours and…
She loves colours. She loves colour. Yeah, that's how you are. If you're a visual person.
I think so, yeah.
I reckon.
Yeah, so maybe that's why when I'm having conversation,
that's how you're processing.
Creating. Yeah. And sometimes everything goes foggy. Yeah. Around you, like I'm like this, everything's foggy, but I'm also inside my brain.
Zoned in.
Should we do your little scenarios now? And then it might lead us into some more questions.
So just some brief examples, multiple choice. They're not prescriptive. They're not hard and fast. And they do not speak to unsafe relationships. So just wanted to include that as well. So first scenario, you asked your partner to put away the washing and they didn't do it. How do you react? A, let your partner know it's important that this gets done and try to understand why they haven't followed through. B, put the washing away yourself and assume they can't be trusted with this task. You now adopt the responsibility for putting the washing away, knowing you will always follow through. C, say they never listened to you, bring up other times in the past they didn't put the washing away and demand they put it away now.
B, what are you doing? Genuinely, let's be full
I thought
for
that
real.
was your answer.
Oh, no. I was like, B as in
yeah,
Bianca.
and then I realized when you were looking.
No, I was letting her go first.
Oh, you said B. I was like, oh, okay.
Yeah, and you're like, I was like, no, I'm letting B have the stage.
Well, I was thinking about it. Can you read A again, please?
Let your partner know it's important to you that they get this done and try to understand why they haven't followed through.
Oh, I'm trying to think me now, how I would react, but me in my last relationship, let's go off that.
And that's when your attachment styles will be activated, usually in your romantic relationships.
Okay.
So the easiest way to kind of think about whether you're one of them is, did I crack it? Do I crack it or do I not crack it? That's the first part.
Yeah, definitely go back to.
Yeah. I would probably go, I wouldn't fully crack it, but I would do it myself. A B probably, do it myself and then say, like, come on, you know.
It's all up to me.
Yeah, come on, dude. Like, I'll do it, but don't rely on me to do this every single time. That would be my response in my last relationship.
Should we break that down? Or should you want it my
Up
answer?
to you guys. You're looking vulnerable.
Nah, what I was going to wait for your response, or we can do me first.
Either way.
Yeah. What
fair?
would that be, do you think?
So B was my example of avoidant,
Okay.
which you've kind of already identified that's kind of where you see it.
Yeah.
Again, it just taps into hyper independence or like, I can't trust other people to follow through. So I need to do everything myself. And trusting someone is too emotionally close, even if it's the washing, comes out in the washing. It doesn't have to be like extreme. Therefore, I can't rely on this person.
Yeah. That was pretty accurate.
Yeah.
I couldn't, And again, that comes from the patterns and the constant actions in that certain relationship that then would bring up those reactions, which then was always my thing was I can never rely on you, even for the smallest things.
Yep. So my argument to that usually in session is, if you're avoidantly attached, you've made a decision about your partner that continues to activate your avoidant attachment.
Yeah.
So you, on some level, subconsciously, whenever like sitting there going, I pick you because you're not going to show up, picked someone who was going to continue this narrative for yourself that it's all up to me.
Yeah. Yeah.
So interesting.
Yeah. Which is then if you do the work. So you can either then after that relationship, it's like you do the work or you don't. And then I would attract another partner the exact same.
Potentially.
You know, if I wasn't aware of that, which I, for the last 2 years, have done the work to be like, okay, not everyone is going to be that. And I don't have to, like, you can see different traits and how I was and what it all goes back to. Yeah. You can, there's so many layers.
Yeah. And it's hard to get there. Like it's such a process of unpacking, understanding, being aware and then doing something with it. Like there's so many points to get there.
Yeah. Yeah. What would be your?
I know that I can rely on my partner. So the only reason I would take the task upon myself is out of respect for his lack of time and availability in that particular day. So I would just, if I was to do the task after asking him or him saying he was going to do it, I would communicate, I've gone and done the washing for us. Maybe just let me know you won't have time so it doesn't sit in the machine and stay wet.
Yeah. Approaching it more reasonably and trying to understand or be curious about why they haven't followed through, which sounds like A.
Yeah. Which is?
Secure.
Secure attachment. Yeah.
Cool. So it's about being able to move through that without getting stuck. And being able to recognize that that action doesn't translate to my worth.
Yes, okay. Makes sense. Yeah, that approach is definitely an evolution of looking at myself and being reflective and aware of my contributions to a dynamic. And so I definitely haven't always been like that. Yeah. But yeah. Cool. I'm proud of myself.
Good job, both of you, for exploring it and being open to thinking about that and working on it. It's not, like I said, it's not easy. Okay. Your partner verbalizes that someone on the TV show you're watching is attractive. How do you respond? A, become very upset with them and assume they must think that you're ugly because you look nothing like that person. B, don't acknowledge or respond to the comment and change the topic. C, agree that people can be attractive without it meaning more and feel assured knowing your partner chooses to be with you. And these are not the only responses you could have, right? Like I said, I just kind of put together examples.
Yeah. Me now would be a completely different answer, but I'm just trying to take me back there.
That's tricky.
And I guess they're all partner-related questions because, like I said, attachment is activated in your romantic relationship.
And how they are showing up as well.
Because, I've got my partner, which was I would have reacted very differently, but then I guess I can relate it back to my most recent situation.
Yeah, do that.
Which was a lot healthier. And my response would have been C. Mm-hmm. But in my last relationship, it would have been a B.
Yep.
Yeah, I would have just not even said anything.
Mm-hmm.
Avoid.
Consistent.
Yeah, consistently avoidant in that relationship.
At least she's consistent.
Yeah.
Yep.
Mm-hmm.
I would be C.
Next one.
Mm-hmm.
Your partner seems very quiet and you feel like something might be wrong. You ask them about it, but they're short and off in their response and state nothing is wrong. You decide to A, ask them a few more times, and if they don't tell you the truth how they are actually not okay, then be really short back to them for the rest of the day. B, let your partner know you can see they might be a bit off and that you're happy to let them have space while also reassuring them that you'll be there when they are ready. C, don't ask again, go out with friends for the day to give them lots of space. Assume that by the time you get back, they would have moved on and don't check in because things are fine now.
Ooh.
B. Yeah.
Nice.
What was B?
Let your partner know you can see they might be a bit off and that you're happy to let them have space while also reassuring them that you'll be there when they're ready.
Love that for you.
Yeah.
And that would have been that would have been my last one and this one.
Yeah.
I was like that.
Nice.
Yeah.
This is such a tricky one for me because
we definitely wouldn't do C, right?
And there might be parts that because like I said, I kind of just threw together example responses. So there might be part of it that you're like, oh, I might do that part, but I wouldn't like ignore them for the rest of the day. And that's still okay. Like you don't have to relate to the whole thing, response.
Yeah. I think in that moment, I would be looking for reassurance from him that yes, something is off, but I don't want to talk about it.
Mm-hmm.
I think I would say, I don't know, because he says this to me.
There's 3 multiple choice.
I know.
Pick A, B, or C.
I can't do it.
I'm boxing you in.
I can't do it.
Imagine it's not about your partner. It's not about him. It's
can't
about
control
you.
that response.
No, but yes, I know.
For the sake of the game.
I know,
A, B,
but
C.
I'm thinking I usually, every single time this happens, I always persevere through the dismissal of something's wrong.
Because you believe it's for the better good, like the better good. Or
because I
that saying
think
is.
Greater good.
Greater good, that's it.
Yeah.
For the better or the greater good.
Yeah. Merge them
for the
together.
higher, for the higher gods. Yes. But he always says to me, okay, I can sense something's up. I'm going to give you a bit of time. When you're ready, I know you'll come to me.
Yeah.
And he can do that. And I go, I like that because he's saying to me, all right, even if you don't want to acknowledge it, I know something's up with you.
Do your thing.
Do your thing, whatever, I'm here when you're ready. Whereas for me, if it was dismissed, I would say, just tell me something's up and you don't want to talk about it.
Yeah.
And then I could walk away.
Yeah. Because you said you want to you want him to confirm that you're not an idiot.
Yeah.
That's anxious attachment, or that's anxiously attached behavior. Because it's again, it's the fear of this person's going to abandon me or not be here because of something that I've done or the way that I've shown up. And I know you're not thinking exactly to that extreme, but that's the place that it comes from. So if he can just tell me things are fine, then I know that I'm fine and we're fine and the relationship's fine. If he doesn't tell me, there's part of me that has to assume maybe it's to do with me.
Yeah, in that sense, I wouldn't be looking for him to say things are fine. It's more just go, yes, you're right in sensing that something's off. I'm just not ready to talk about it.
That's him. So you're talking about his response?
Yeah, that's
so
what I would.
So if you took away his response and just looked at yours, what you needed.
I'm seeing it now.
Yeah.
Okay, yeah. Anxious.
Yeah. which is fine.
Yeah.
It is what it is.
Yeah, and we all have parts, everything, you know.
And like I said, the work is just knowing. Like the first part is just knowing. When you know, you can do something with it. When you don't know, you wouldn't be trying to change something or make any difference or make it better because you don't actually know.
That's so true.
Mm-hmm.
Last one. Your partner hasn't replied to your non-urgent text that you sent 2 hours ago. What do you do next? You don't end up texting them for a few days after this. Initiating that conversation was enough for you for a while. B, assume something is wrong and text them a few more times asking if everything is okay. C, remember that they're at work today and that they usually reply on their breaks. Once they reply, you then naturally continue conversation that you initiated.
C.
I would go C in that scenario, yeah. Yeah.
Nice. The secure option.
Yeah.
So that's a good demonstration that there's parts of everything.
Mm-hmm.
Yeah. And you don't identify with just one.
Mm-hmm.
Yeah.
And like I said, those responses might look really different or you might identify with parts of it and not other parts. That's okay. It's definitely not prescriptive.
Yeah.
Yeah.
Just
So,
a
yeah.
activity.
If you guys
I love
listening
it.
can't pick A, B, or C, there you can make up a D.
I like when it's just multiple choice because, people like you.
Well, we got a
If you're
podcast for a
listening-
bloody reason.
If you're listening, that was hard. Trust me, I was seeing Olivia squirm trying to pick 1, 2, or 3. But it's a good little thought-provoking thing to make you be like, okay, what? Because each scenario was small and different. So which scenario triggered certain things at certain times, you know? Yeah. I love that.
Good job.
Thank you. That was so cool. Do you find anxious people attract avoidant partners? Or why do you think that is?
Yeah. A lot of the time.
Yeah.
Yes. Anxious attachment and avoidant attachment are attracted.
Yep.
They basically do this kind of, and I think I said I'm a hand talker. So
Yeah, no,
in
it's
sessions,
good.
I literally do this. I'm like, I
Guys,
don't want to
you
hit
gotta
the
be
microphone.
Watch the video.
But they do this dance.
Yeah.
And why I do like that kind of dance is a person who's anxiously attached is always seeking reassurance.
Yep.
Let me know I'm important. Let me know my needs matter. Let me know I'm worthy. An avoidant person is not comfortable with closeness or intense intimacy, like closeness emotionally.
Mm-hmm.
And so they go, give me space. I need time. Pull back because you're confronting me too much. So the anxious person's going, tell me, tell me, tell me. And the avoidant person's going, no, 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 go away. And then they kind of just are in this flow of like never really connecting because neither need is getting met.
Mm-hmm.
In terms of why they attract, I don't know. As it's like some kind of subconscious puzzle. But again, it's about reactivating those same patterns that have happened throughout your life. So it's important to us to have predictability, like I was saying, and predictability comes from our past experiences. So we subconsciously seek to recreate the relationships maybe we had with our parents in our relationships with our romantic partner.
Mm-hmm. Yeah, that's why I feel like there's a pivotal time to break that cycle. And I've had so many chats with really good friends where they attract the same. And again, this isn't like the same for everyone, but you attract the same partner as, say, your dad or say as someone else. And it's like break that cycle if it's not a healthy thing. And I've had to have chats with my friends and, it's up to them to do that. And it gets to that point. I know my last relationship, if I had followed down that path, it would have been, a similar dynamic to my parents growing up. Not that that was a very tumultuous relationship, but again, anxious and avoidant. So it's you're constantly chasing this thing that it's never going to happen. So I find everyone, I'm sure there's a lot of people listening being like they might be in that relationship right now. And to get to that point of breaking that cycle would be really tricky. But what would be your advice or things to really ask yourself to get to that point?
I think a little bit of going back to just noticing what's happening for you. So when you're reacting, are you noticing it coming from this place of like urgency or threat? Are you noticing that I need to do this right now, otherwise something really detrimental is going to happen. Is there immediacy and urgency that's coming out in your responses? Understanding the place where that's coming from is going to take work, but it will at least help you decide, am I making that decision because it's coming from a place that I actually want to show up in this way? Or am I making this decision out of a place of fear that this person's going to go away, or fear that I'm going to be a failure in this relationship, or something really bad's going to happen? And if you notice it's coming from that place of urgency, then it's probably something to look at.
Yeah.
That's a good prompt, like sense of urgency.
Because it can feel really intense. Like the way I talk about it is very kind of matter of fact and neutral, but the intensity that drives these behaviors, like you almost are just going through the motions. Like you're not even noticing half the time when it's happening. You just feel like it's the right thing, or like I have to do this thing.
Yeah.
Like you're in a rush.
And I think that goes back to, if you can't decipher it yourself, it is go and get that professional help, because it triggers certain questions that you probably wouldn't be able to do, you know. But so I don't think there's anything wrong with going to talk to someone. I think that's shows that you want to really take the next steps in breaking an unhealthy cycle, which I think is amazing.
I have always said I think therapy is fun, and I know that's a weird way to phrase it, because a lot of the things that I work on with people are not fun. But what I find fun is people building that insight to themselves and having a sense of being in the driver's seat of their life, and taking back that sense of control, but in a healthy way. And so I always say, everyone should go to therapy, but I also say you don't have to wait till things are bad to do that.
Because you do think like if you're feeling really good on a day and you've got an appointment booked, you do have that thing that crosses your mind where you're like, oh, I don't actually need to go. But then for even your therapist to have the difference and the contrast of you on a good day and you on a bad day, like it all adds up into the book of you. And like what you were saying about it being fun, I feel like I've always been a little bit like, why am I carrying this essence of excitement and fondness of my struggles with binge eating? And it's because I'm almost giddy at all the things I've learned since being able to come out of that. And even like in our conversation now, I can feel that I'm so mentally stimulated, and that's why I want to talk so much, because I'm like excited and it is fun. And obviously sometimes when you're in the thick of a struggle, it's not always going to feel fun. But I just really resonated when you said like it's fun. I'm like, that's what I'm feeling.
And I think when you are, when you would see clients who are not on the other side, because I feel like it's never ending, like the work that you're doing, they would have that pep in their step of being like, no, I'm putting in the work to be better for myself and for my partner and for my children, and then to carry that on.
Absolutely.
I think that's so cool.
And it's so nice when they get to the point where they're like, oh, well, this thing happened and this is what I thought and felt and this is how I responded and it all turned out great. Like, fabulous. That's awesome. And you did all of that yourself without me.
It is awesome.
And that's exactly the point.
Yeah, I love that.
Yeah.
Growing.
Literally.
But I always like message Liv. So just a quick scenario. With my last person that I was in a relationship, seeing for a while, the way I would have reacted me a year ago or 2 years ago would have been so different. And I would like message Liv and be like, oh my God, like you'd be so proud of me. I didn't even, I didn't flip out at this, or I didn't react like this on a night out, and like things that would have pissed me off just wouldn't. And I'm just handling confrontation just so much differently, which is cool. And you get so excited about it.
And you should celebrate the wins. I'm very big on celebrating the wins. No matter how small or big. It's so important, because we spend so much time focusing on where we're falling down or what we're not doing well enough or what we're struggling with. We don't give that same time and attention to the things that we are doing really well. And there's no reason that we do that. Like there's no reason that you have to focus on the deficits and not the strengths.
Yeah. And I think that's important as a friend too. You know, if you see your friends, you know what they would have been like, and now you're seeing how they're handling situations. I think it's nice to acknowledge that.
Yeah.
And then they're just going to keep that going.
Yeah.
So I think that's
definitely.
There's definitely so much power and strength in acknowledging behavior that you're not quite proud of. And I think that a lot of people, I mean, I'm assuming a lot of people would shy away from going and seeing a psychologist because they don't want to be told that they're behaving in undesirable ways. You know, they don't want to look at themselves, and that could come down to a lot of shame. But when you do, and I'm so proud of B for doing this from like way when we first started the pod, and since she left her last relationship, she'll always identify, okay, I know that I probably would have been more reactive in this situation. And, you know, admitting that you behaved in a way that is, you know, on paper undesirable actually gives you so much strength to then, I don't know, what just speaking it makes you, do you know what I'm trying to say?
Then you can do something with it.
Yes, like you're taking the power away from it and redirecting it by saying, you know, that isn't me. That's something that I've done. And yes, it's. I'm trying to say, like, it's hard to say, oh,
accountability.
Yeah, literally. That's done.
Yeah.
And then instead of
It's
it
hard.
driving you then get a decision to drive it.
Yeah.
Yes.
Yeah.
And
Yeah.
I just think,
Really cool.
yeah, the accountability thing is daunting, but so fun.
Yeah, it is. I have another question about this, and I'm sure there's a lot of women listening, being like, how would they? Okay, if I was a woman listening right now, and I'm in a relationship, and I'm feeling, should I be feeling like this? Is this toxic? Is this unhealthy? Versus a healthy relationship, what would be core questions to ask or to have them answer for themselves of whether this is healthy, whether this is not healthy?
Why do they have that question in the first place? Is the first place to start. So there's part of them that's questioning the health of that relationship.
Yeah.
And then also unpacking some examples of that. I think with women, we have this default of needing to show up in a particular way that I think society encourages us to do. And that's to kind of hold it together, be the bigger person, be validating and supportive, and not take issue with things necessarily, like be polite and be quiet sometimes. And this bleeds into our relationships. And so how it usually starts is kind of like a few small things. Oh, that's fine. Or I'll just not worry about that. Or that just doesn't matter. And then that becomes a pattern over time. And then what they do in that process is lower their own self-worth because they think that their needs are too much or they're asking too much or, you know, compared to, say it's a male and a female, compared to this guy, maybe the dating pool's really crappy and I would rather have the bad things that he has because someone else might have way worse things or things that so kind of like out of like fear of there not being enough or scarcity. And that's really hard. It's really hard to balance that between, I guess being a woman, being in a relationship and knowing kind of what you deserve and what is worthwhile kind of pushing through and what can be worked on and maybe what can't be worked on. So it's a bit to flesh out, I guess.
Yeah.
But it can be really hard.
For sure. Yeah. And that just goes back to, again, confidence and doing the work. I guess taking yourself out of the dynamic of being you and your partner is you can still be working on yourself in that dynamic until I think you feel strong enough to really be like, no, this is what I deserve. I'm not going to settle. I'm going to find someone. There's people out there, like, it's not like you're never going to meet someone.
Yeah.
So, I think people think, again, you need to have this huge breakup, then do the work, but you can be doing that work in that dynamic.
Yeah.
Absolutely.
Yeah.
And at the end of the day, like if you're modifying your behavior or accommodating in a way that's not authentic to yourself, that person's not really in a relationship with you anyway. And so that's something to think about. If you can actually show up as the person you want to be, they may match that energy or they may be like, not for me. And then you don't actually have to make a decision because it's made for you.
They make it for you.
Yeah, when you're trying to make sense of a scenario and someone else isn't doing what you want them to do, just focus on yourself and how you're showing up, because that's all you can really control.
Yeah, exactly. And I think, projecting that responsibility onto someone else leaves you stuck.
Yes.
If you're constantly waiting for them to shift and they can't get there for whatever reason, you then become helpless because your measurement is, have they changed? And then suddenly you are not in the driver's seat again. You're in the passenger seat.
Yep.
So when you put yourself back into the driver's seat, I get a choice over how I interact with this person or how I engage with them or what I expect of them. I get the choice to accept them where they're at or not accept them at all.
Yes, I love that. You get a choice when you put yourself back in the driver's seat. That's why accountability is fun.
Yeah, and then there's some people, again, that just can never take accountability, and that's...
Yeah, what do we do with them?
Accept them as they are and they're either part of your life or they're
move
not.
on. Yeah.
Yes, okay.
It's very like...
Yep.
Do you have room for that? Can you make space for that? Is that negotiable to you or is it not? Is that your non-negotiable? Is it a preference or is it non-negotiable?
I like that word, accept. Because when you first said that, I don't know if you caught my reaction, but I was like, yuck, don't want to do that.
Yes.
But then I thought about it. That actually sets me free from a lot.
Because ironically, like if that person that you're talking about is doing that, you're actually doing the same to them by expecting them to be different than they are.
How can someone stay grounded in a world that constantly triggers comparison?
Social media wise, are you talking about?
Sure.
Yeah. It's so hard because we have so much access 24/7, as much as we want, whatever we want, whenever. And that's really, really hard. It is probably a new and ongoing difficulty I'm going to see more and more in my rooms, more so than ever.
I think so.
Just because of that, because of generationally where things are at. And I guess like the feedback is always comparison is the thief of joy, right? You can't, it's like when we talked about the measurements before about people's anxiety, it's individual to everybody.
Yeah.
So your measurement of yourself is individual to you. So trying to use a measurement that's here and place it there on someone else and say, well, they've got this or they do that thing or whatever it is, it doesn't rationally make sense because their scale is completely different. Like their scale could be in numbers and yours could be in words. Like how do you actually compare that?
Yeah, how do you even compare?
Yeah.
And so like I guess like unhelpfully that advice is don't go down that path.
Just don't
do it.
But recognizing that comparison also comes from a place of being unhappy about something within yourself. Is that actually reasonable, whatever you're unhappy about? Is that workable? And does that actually need to shift? Can you do that work? Or are you kind of torturing yourself? And if so, then why? Like what's the function of the comparison, I guess is the question. Yeah. And I know I didn't really answer.
No, but that's all you can answer. And I think that's why it's so hard to answer when people do ask it, because it is a common thing people ask. How do I stop comparing myself to girls on social media? How do I stop comparing myself that I'm not at this certain phase in life, blah, 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 blah. It's like it's hard to answer that because it comes, all you can control is you.
Yeah.
So what are you unfulfilled about? If it's your job, change it. Nothing, if you have that capacity to change things, do it.
Yeah.
Like I think there's always an option or talk to someone. Like there's always avenues, right?
Yeah.
Yeah.
And if you're not accepting of yourself, like what's going on there that you can't accept the person that you are or what you bring to the world or what is it that's blocking you from being able to do that? And is your measurement external? Have you decided how you measure your worth is by what you look like or by what other people look like? And if so, let's work on that.
Yeah.
Like, are you measuring whether people will like you based on what your hair looks like? And can you reassure yourself that the right people don't focus on your hair and actually your hair isn't any indication of who you are as a person or what you bring into the world?
Yeah.
It's hard to get there for sure, especially if that's like an automatic pattern. I would also say two things can be true at once. So you can have terrible hair and be an awesome person.
So true.
Or that job can book somebody blonde and somebody who has brown hair.
Yes.
Yeah.
So true.
Yeah.
That's such a good statement.
Like we don't have to pick. And this is what I say to clients. Like you don't have to pick. half of your stuckness and your struggle is feeling like you have to pick from these really these two really bad options, or these two like pretty crappy options.
Yeah.
But actually there's all these options in the middle and two things can be true.
Mm-hmm.
So you don't need to be stuck there.
Yeah.
Love that.
What's one misconception people have about therapy?
That I'm going to fix them and that I have all the answers. When really they will be doing the work and that will be a self-exploration.
Yes. Like you said, you're teaching them to have they come in with an empty tool belt, you're giving them a tool, and then all of a sudden they're out in the world with a full tool belt and you're not there.
Yep.
Love it.
I love that.
Do you find that a lot of things come up for you when you're in that professional seat in a room compared to like in your personal life? But obviously you in your private personal life as an individual, you have your own attachments and traumas and all this. So I guess psychologists need psychologists too, right?
Yep.
You can't just educate yourself enough to go, yeah, I'm good, I can be my own advocate. Is
and
that
like split
true?
yourself off essentially into a therapist versus a person.
Yeah.
And this is kind of what I was speaking to earlier about the supervision. So this is what we would call countertransference, when something in the client activates some of your own stuff, which can then get in the way of the therapeutic relationship or the outcome. And that's something you would work on in supervision if it was appropriate professionally. If it's too personal and it actually requires you to work on whatever that thing is, then yes, seeking therapy around that.
Yeah. So almost like it would be, it's like bittersweet because you could, if say you've gone through something and you've healed from it, you feel really good about it, you feel like you would be a perfect psychologist for a patient going through that. But then that could also trigger things for you. So maybe you're not quite like there's just so much to it.
Yeah. And then also it could trigger more need to help within you. If you saw yourself in that person, you might treat them differently than a different client because,
oh my gosh.
It's essentially you sitting in the chair, or you might be prone to disclosing more, like self-disclosure more than you would typically with clients. And then that's problematic.
Yeah.
But yeah, that's so having a supervisor and having your own therapy is really important to ensure that that's not playing out long
and you're
term.
seeing things exactly for what they are and maintaining that professionalism. Yeah. It's so tricky to be professional in an environment where it's like human brain mentality. Like, okay, wow. From a psych perspective, do you believe in manifestation?
Do I cover that and teach that in session? No. Do I know that that's a massive thing that works for a lot of people and that they really find beneficial and effective? Yes. In psychology land, we would call that cognitive bias. So like if I'm looking for red cars on the street, or if I've got red cars on my mind and I'm thinking about it, suddenly I'm seeing all the red cars in the street.
Yeah.
And so that's kind of like putting out there what's in my mind, and then that's what I'm focused on. And that was a bit of a silly example, but you do that with kind of everything.
Yeah.
So if you perceive yourself as someone who has a lot of problems, you're going to be seeking all the information around you that confirms that you have a lot of problems. And then you're probably not going to have very good self-esteem as a result. Whereas if you're kind of seeking the information and the input that tells you that you're successful and motivated and a good person, like that's what's going to stick in your brain. It's like a fishing net, and you're like catching, the type of fish that you want.
Yeah. Yeah. Wow. Same manifestation. You could see that as that law of attraction type of vibe. Yeah. Same.
Does that make sense?
Yeah. It's really good. The car thing is so accurate.
Yeah.
You're like, what the? All right. Last one.
All right. What's one taboo topic in psychology that needs more honest discussion?
Taboo topic. I think I'm terrible with this because I feel like nothing's off limits really when it comes to me and chatting about things, particularly in session or with colleagues and things like that. Taboo.
Or if you want to change it, let's say what's one thing for everyone listening you would want them to be more honest about or be discussing more with friends and family, or what's something that jumps out at you as a little takeaway?
Something that people could talk more about is just what's going on for them, and obviously picking when that's safe to do that. So if the reason that you don't talk to family and friends about it is because they're dismissive or unhelpful or invalidating, then I don't think pursuing that is necessarily helpful. But maybe having the conversation around, like, I wish we could be closer, or I wish I could talk to you about these things. I think the biggest thing that I'm seeing people struggle with is disconnection and isolation. And so I would say doing the reverse of that is what I would encourage. So I guess the taboo part is don't feel like you can't be true to who you are, or that you have to close off parts of yourself for other people to be comfortable. I just ramble around and around.
No. Loved it. And one more little takeaway. What can the listeners do if they have someone close to them that's struggling with anxiety, and it could potentially be a cycle that their friend or family member has shared with them is happening?
Mm-hmm.
How can we be of best support to those people? And can you be too smothering? Can you be too,
distant?
Yeah. Like, what would you suggest?
I would always suggest ask them what's helpful, ask them what they need. They may not know, but if you're kind of guessing and getting it wrong every time and you also don't know, that could be unhelpful for both of you.
Mm-hmm.
If they don't want to talk about it, respecting that.
Mm-hmm.
But yeah, ask them, do you need to talk about this? Do you want support? Do you want me to help you look into finding someone you want to see? Do you want me to leave you alone? Do you want me to help you talk to your family about it?
Mm-hmm.
Like, just actually inquire with the person what they would find helpful, because that's a lot of guesswork for the other person.
Yes, and B and I touched on this before. As friends, you think that having this initiative before needing to ask your friend what they need, you think that that's what makes you a good friend.
Mm-hmm.
But there is so much power in, like you said, just asking them what they need.
Yeah.
Maybe not, all of the questions at once.
Yeah. Just examples.
Yeah. Do you have any ideas of what you think you might help you today?
Yeah. Or, like, I've noticed, you can always just start with being curious. Like, I've noticed you don't see yourself, or I've noticed you've been a bit off. Is this something you have noticed? Do you want to talk about it? I'm here for you. But yeah, do you need me? Can I show up for you in a different way that you feel like would be helpful or that would make a difference?
Yeah.
They may not accept it, but I guess the alternative is, like I said, you might be doing things that are secretly unhelpful and you're not actually aware.
Yeah, I like that you said not helpful for either of you, because it's a conflicting position to be in when you want to help and you don't want to give them more things to think about, worry about, decide on.
Mm-hmm.
But then if you're doing the wrong thing, it can, just not help at all.
Yeah. And just, I think, when it's people that are close to us, we want the best for them. We want them to be okay. We want them to move past whatever's keeping them stuck or uncomfortable.
Yeah.
But being able to be comfortable within yourself that will be their process as well. So being able to sit in it with them rather than kind of needing to move them through that so that things can be okay. Because our intentions are great. Our intentions are, we want this for you, want you to be okay, want you to not struggle. Sometimes the message doesn't land that way though.
Good point. So more patience and acceptance.
And here if you need.
Yes. Availability.
Yeah.
Love that. Yay.
Oh, well, is there any other little takeaways or anything you'd want to leave our listeners with before
just go to therapy?
Before we go?
Therapy is fun.
Yeah.
And if, I guess, thinking of going to therapy, say someone's listening and it is daunting, or, they can't afford it, what would be the next thing?
Speak to your GPs, speak to the practices. Sometimes psychologists will do reduced fees or bulk bill. They just won't always advertise it. So always ask. You just never know. There's a lot more online support and self-directed support. There's heaps of good, even Instagram videos and TikToks that can speak to a lot of stuff. A lot of it is not necessarily helpful and not necessarily factual. But there is a lot of free information and self-directed work that you could do as well if there's a barrier to going to see someone.
Yeah. Thank you so much, Sam.
That's okay.
We definitely, learnt a lot, and we appreciate your time.
Thank you for your time.
It's really
so
fun.
much.
Yeah. Thank you so much.
All right, bye guys. Love you.
If you enjoyed today's episode, don't forget to like, comment, subscribe,
and just remember, sometimes you gotta live
and just let things be.